Hello, and welcome back to the next episode of Shining the Spotlight, our special feature where we shine the spotlight on some of the really inspiring dental nurses in our profession. And this week we've got a real treat for you. He's the lead dental nurse in the main theatres at Homerton Healthcare NHS Trust with a specialism in oral maxillofacial surgery. His career has taken him through some of the UK's most respected hospitals, including the Eastman, Guy's, Royal London, and even Harley Street. And he's built an incredible skill set along the way. So everybody, please welcome Renz Sindac. Hello.
Hi, Cheryl. How are you?
I'm very well, thank you. Thank you for joining us
Oh,
on the
yeah, of
podcast
course.
today. Did I get everything right there? Is your
Yes,
resume?
yes, definitely. That's like a really excellent introduction.
Just sounds absolutely incredible what you're doing at the moment. So
Thank
not
you.
only that, but you're also a new member of our SBDN team, so one of our new ambassadors. So
Yes,
welcome to the team as well. Like
thank
we're
you.
super excited to have you on board. But we want to find out more about you, Ren. So
Sure.
let's go back. Let's go back in time. What was Ren's like as a little boy?
Oh, as a little boy, I was more of a like just enjoying life as a kid. Playing games, meeting friends. I was more of an extrovert, outgoing, hanging out with friends down. I remember that was like back in the day. I was in Trocadero, the old arcade place where we
Yeah,
normally go out for Friday.
yeah.
And yeah, I was more like a free type of person, enjoying life.
Amazing. So what was school like for you? Did you enjoy school?
Pretty much so. I have I have my own circle of friends where we always meet up during schools, and even like after school we hang out. We even have like our own little club of like playing card games, which was fun. I mean,
Love
besides
that.
all the focus from like doing math, science, and all these
Yeah.
subjects, so we have these side topics where we enjoy the most with our hobby. Yeah, it was really like it's great to look back, to be honest.
Yeah. Amazing. So what brought you to dentistry? What was your journey into dentistry?
Oh, well, actually, it started where because my family background, my mom is actually a nurse, a general nurse, and so when I was a kid, I always look up to my mom as and as my biggest inspiration, and obviously, being the middle child with
Right.
three boys, I have like two brothers along with me, so I was being the middle child. She was really like keen for me to follow her footsteps, and obviously, I take it as it was an honor.
Yeah.
So I did started as general nursing. So I did
Right.
study general nursing for a couple of years. That was back in Middlesex University. I enjoyed my couple of years there. But on my second year of nursing, I realized, I need something more, specialized area, more
Yeah.
specific. And then it just comes across with the dentistry, and
Right.
I was thinking, I just found out like, oh, there's such thing as dental nursing. I
Yeah.
love the hours, the 9 to 5,
Yeah.
the flexibility, and obviously behind it is I was more intrigued onto the oral health topic. Around the mouth area, around the
Yeah.
teeth,
Yeah.
and like nowadays we are so focused on the general side of the anatomy of the body, and we kind of like forget about the smile and the teeth and
Yeah.
the oral health.
Yeah.
So
Absolutely.
at that point, I was like, this really pulls me in.
Yeah.
So I said, why not? So obviously, after 2 years of general nursing, I decided, okay, I'll take this dental nursing because that's where my heart is. I'm just gonna
Mm.
follow it. My gut feeling tells me just try it. So I did
Yeah.
try it, and obviously, as soon as my mom found about it, she was like, obviously, a little bit of disappointment,
Yeah, I
but at
bet.
the same time, at the
But
same
proud too,
time, yeah, of course, at the same time, I didn't really branch out of nursing
though.
completely. So it was still nursing, but more
Yeah.
on the dentistry side. So
Mm.
yeah, I followed my heart and look where I am now.
And you ran with it. So, what was the
Yeah.
training like for you? Did you train in the hospital?
Yes,
Where
I
did
was
you train?
trained. I was trained at the Eastman.
Hmm.
I applied there. Obviously, I told them that I had my 2 years of general nursing, so I had a certificate for it, even though it was incomplete.
Yeah.
So they accepted that, and then from there, um, it was more of a. I like Eastman because it's not too. I think it's for me. It's a bit more old school. Like
Right.
the teaching is more like a lot of handwriting, less
Yes.
computer,
Yeah. Yeah. Yeah.
and then obviously there was where there's a lot of background behind it. During during my first session, my first year, I was so happy because there were three three guys including me. And obviously, in dental nursing, majority is on the female side.
Yeah.
So
You're a
it's
minority.
nice. Yeah. So it's nice to have like, oh, finally have like some boys with me. And
Yeah.
then we made a pact at the beginning of the year saying like no one's gonna back out, no one's gonna we're gonna graduate at the end of
Yeah.
this course.
You're gonna
We're
do
all
it.
gonna go together. We're gonna do it. It feels like a movie. Like this is the first sequel. We're gonna go for it and then aim higher. And then yeah, I think the more I get into it, the more I enjoy the dental nursing course. And obviously, I had my principal, had my tutors. I'm very grateful for the teaching that I learned from them.
Yeah.
Traveling as well from my home because I live in Hackney all
Right.
along. So traveling to Eastman down King's Cross is it's always like a busy road.
Yeah.
So I get the hang of it. But at the same time, I think it's just the oral health topic that really brought me into this dental nursing journey.
Oh wow. So,
Mm.
what's the day in the life? What was the day in the life like for you then when you at the Eastman?
Oh, at the Eastman, I feel like in at the Eastman, it's more like I'm more focused because it feels like being in the Harry Potter scene where like you have an old
Love
school
Harry Potter.
principal and then she wants something a lot, like very disciplined. You
Yeah.
have to be there, you have to focus. Every
Mm.
single mock exams, you have to achieve this mock. So we were really like onto it. I was really onto it. I was
Mm.
like, this is it. There's no, I can't be messing around and just,
No.
solely putting my concentration and focus to
Yeah.
it.
Yeah.
So every mock exams, we have this different topics, like either it could be like the anatomy, the x-rays,
Yeah.
treatment procedures. So it was very interesting how we were being taught the old school way.
Yeah. Yeah. Yeah.
It was I mean, now if you look if I look back now, I think it's more modernized now. um
Absolutely. Yeah.
I
It's more
remember
apprenticeship based, isn't it? And that,
exactly.
yeah, all hands on
and
more so than
then
written.
and then the ROE, I remember, I think we were the last batch to do the
Mm.
hand folder. We
Yeah.
weren't
Yeah.
doing the computer. um and then yeah, I was amazed how I was taught in there. And then we always have this gathering every Friday, like 'cause at the Eastman is such a really fantastic building,
Yeah.
with a nice fountain outside. I remember purely how it was. And then when it's like summertime, it was hot like this. We hang out outside. We have this like I remember this. We haven't got like a tunic. We had this like a minty green polo T-shirt for guys and even for girls.
Yeah.
So it wasn't really like medical type of nursing where you have like white tunic or blue
Yeah.
tunic. It was like a proper. And then I remember when my friends, my guys were talking about the coloration of the tunic, the polo shirt. We were a bit like, oh, we put off of it, but I was like, oh, this is just the beginning.
Yeah.
This not gonna be for too long.
Let's
And
just roll with
then
it.
exactly. Let's just roll with it. It's not gonna be forever. We're gonna have our
Yeah.
own proper either scrub or a white or
Yeah.
blue tunic. So yeah, it was like an exciting times for everybody. When I graduated at Eastman, yeah, like I said, it was pretty like an old school team. We didn't have
Yeah.
like like what do you call that again? The hat.
Yeah. Yeah. Yeah.
So
Yeah.
we were just like wearing our own formal shirt, like suit and tie, and it was
Wow.
so nice. It was so nice to be
Yeah.
honest.
Oh wow. So what then? What led you? What was your next path after graduating?
So after graduating, I said to myself, because obviously I was trained at Eastman, I
Mm.
want to work for a couple of more years, yeah, at Eastman as a
Yeah.
qualified dental nurse.
Yeah. Yeah. Yeah.
So during my first year as a newly qualified, I think I was assigned to work for periodontics. So that time, I remember on my first day, I was really put to a deep end,
Yeah.
where obviously I had a periodontist with me. It was kind of like straight away I had like a massive learning curve because I had
Mm.
a really demanding periodontist. The first day was like really intense because obviously the technique to suction. Obviously, I wasn't a pro yet. Um, I was still
Learning your
finding my
trade.
yeah, I was still finding my feet. And then I remember, obviously, the periodontist was a bit moody and things like that. I had a really bad experience, to be honest.
Oh.
I think he threw one of the instrument, and I was like, "Oh, I'm sorry, I'm just here to help. I'm still learning. I
Yeah.
just
Yeah. Yeah. Yeah.
qualified. So
We've all
if
got to
you
start somewhere, right? Yeah.
exactly. And I really had to speak up to myself, and I said, if you do not want me on your area to work with you, I'm okay with it. But
Mm.
obviously, if you can give me more patience,
Yeah.
working with you
Yeah.
as a newly qualified,
Yeah.
then I'll find my way, and obviously I'll do the best I can to learn as quickly. But obviously, he didn't take it, so it was fine. I take it
Good for you,
as
though. Good for you.
constructive,
That takes a lot.
you know.
That takes a lot to literally
Yeah,
have the guts to speak up for yourself.
definitely.
And you've got to give respect to earn it, and that goes both
Yeah,
ways, doesn't it?
exactly. And then
Yeah.
from there, ever since that took place, I think the periodontist remembered my name, and obviously, as I developed as a good dental nurse, he remembered me. And at the end of the day, I think after a few months, we got along, and then
Yeah.
I found my feet. Because in the dental nursing world, it's always like the horror side of it is like when you get put on the deep end and you don't know what's
Yeah.
going on. You don't know
Yeah.
what to expect. But I always
No.
said to myself, not to expect anything when I'm doing something, because at least it would reduce my disappointment, and it will just give me that motivation at the end of the
Yeah.
day.
Yeah. Such a good mindset to have. That is such a good mindset to have.
Yeah, thank you.
Oh my goodness. Love that. So what did you do after that? So you obviously got the bug for dental nursing
Sure.
and to grow your role. What did you do then?
So after working for Eastman for almost more than 2 years,
Mm.
I decided to, I think, step out of my comfort zone.
Mm.
I said to myself, I can't. It's not because I don't like working at the Eastman. It's because I want to challenge myself and
Yeah.
to be out of my comfort zone, because I'm very familiarized to how Eastman works and how the routine ways been done every single morning, and the treatment that I'm doing there. And obviously, I'm grateful to all the staffs from Eastman, because I've learned a lot from different dental nurses and
Yeah.
clinicians. So when I look back, I said, okay, I'm going to step out of my comfort zone and look for another NHS Trust, and then it just came out to be the Guy's Hospital.
Okay.
Mainly because um, they offered me to the role of being in the oral surgery slash oral medicine. And then at the oral medicine side, we take bloods for patients.
Okay.
So I was trained there to do my phlebotomy training, which is another qualification that I enjoy as well. And on the oral surgery side, I learned a lot more about maxillofacial surgery, where the
Right.
extraction and the
Hmm.
biopsies. At the same time, it wasn't solely focused on those two departments. When we are needed to help out and support other departments, we can be circulated onto other specialty like orthodontics,
Yeah.
and perio. And obviously, my perio skills was still there.
Yeah.
And
You're not going to forget them.
yeah, and then somehow, even though I was working in the Department of Oral Surgery and Oral Medicine, I really enjoyed doing implants when I was at
Okay.
Guy's. So I think the surgical field really got attached to me as a dental
Mm.
nurse.
Yeah, yeah, yeah.
I love the whole surgery team, when
Yeah.
you have to do like aseptic technique and
Hmm.
looking after
Yeah,
instruments,
yeah.
and obviously you have to look after your surgeon or your clinician.
Hmm.
Because at Guy's Hospital, when we do implants, we always to be very thorough to what we
Hmm.
do, especially on the clinical side of the patient notes. Everything is must
Yeah.
be accurate, medical
Yeah.
condition,
Mhm.
consent form, which is very important.
Absolutely.
So yeah, I really enjoyed it because besides from learning that phlebotomy, I also did the in-house training for conscious sedation, which is
Okay.
very cool.
Yeah.
So when I had my first conscious sedation patient, I really love it because I felt like I was in like kind of like an ITU kind of thing. You focus on one patient, you always
Yeah.
look on the vital signs,
Yeah.
make sure the patient is okay and
Yeah.
responding.
Yeah. 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 Yeah.
So I love, I love the experience at Guy's Hospital, and
Yeah.
I think I worked more than 3 years there, which I
Oh,
didn't
right.
expect. Maybe because I enjoyed the environment, and obviously when you obviously come out of the building, you always see the Shard and Tower Bridge
Yeah.
every day.
Yeah.
So
What a treat. Yeah.
that was a treat for me.
Yeah. Amazing.
Mm.
So you've got your phlebotomy, you've got your implant training.
Yeah,
So
in
you're
in house.
obviously
Yeah,
it was obviously like
it was
you were
building up, to
finding
be
your passion.
honest.
Yeah. So what
Yeah.
happened then? Where did
Then
your path lead you then?
so after Guys, obviously I'm very much of a person who likes to challenge myself
Mm.
after like maybe like couple of years or 3 years. So I said, because when I was a student nurse, I always see the other side of student nurse being trained away from the hospital.
Yeah.
For the dental nurses who qualified from being in the practice.
Mm.
So to that point, I decided, okay, I'd like to try out a private practice.
Hmm.
So because of my implant experience at Guys, I decided to apply for a specialist implant private practice at Harley Street.
Okay.
And then I became the specialist implant dental nurse. Um, and then from there, I said, okay, this is a different environment. It's not hospital setting
Yeah.
anymore.
It's a lot different, isn't it?
Yeah, the demands would be a lot more, different completely
Mm.
from the hospital. So when I moved from Guys to the practice at Harley Street, um, I enjoyed my first 6 months because obviously with I was so proud to be like a specialist
Yeah.
infant
Yeah.
dental
Yeah. Yeah.
nurse,
That's
and then
amazing.
we do, yeah, and I think I realized in the practice I give a lot of respect to the dental nurses
Mm.
who were trained from the practice rather than the hospital because
Yeah.
they work very hard. I mean, you have to do the sterilization, the decontamination,
Yeah.
and you do everything. So
Yeah.
when I was there, I didn't like I said, I
Shock
wasn't.
to the system.
Yeah, I was not.
What's an autoclave?
Yeah, I was not, what's this? I mean, don't you have like a sterilization department? And I realized, okay, I'm not in hospital anymore. We have to do
Yeah.
it ourselves. And then because as a specialist implant dental nurse, I have to do it myself, ensuring that the all the implant components are present in the kit.
Hmm.
It wasn't just like dental nursing in the practice. It was more like you're an admin, you're a technician,
Yeah.
you're a
Uh-huh. Everything.
receptionist.
Everything. Yeah.
You even like you're handling complaints as well for patients. And then you're handling the lab as well.
Yeah.
So I realized
Yeah.
how the demand in the practice is more higher than in the hospital. I felt like being in the hospital is such a for me it's like I mean, I don't want to give it the wrong way. It's more like a paradise. You know, you're more relaxed, you're more calm,
Yeah.
no storm at all unless something happened like out of the blue. But you know, like I said, you know, being in the practice, when I was working at Harley Street, we're doing like back-to-back patients,
Mm.
and then sterilizing instruments at the same time in between.
Yeah.
And obviously, I realize in the practice as well when they always, I always hear this a lot when they say like they're promoting the Hollywood smile, the
Oh yeah.
cosmetic side,
Yeah, 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 yeah.
and then you know we always have this various type of patients of what treatment they want, and then we have this treatment called all on 4 where
Yes. Yeah.
all your teeth been taken out and then replaced by
Yeah.
implants. And I was saying,
Mhm.
how can someone can just say yes to that one and lose out all their real teeth
Yeah,
for
yeah, yeah, yeah,
prosthetic
yeah.
ones? It's just
Yeah, yeah.
unbelievable how
So,
cosmetic can do to one person, to be honest.
I think social media's got a huge impact on that, isn't
Yeah,
it? Um,
exactly.
yeah,
I
but
agree.
you see all the great stuff, but the understanding of your mouth and your gum health and your general
Yeah,
health, how that is all impacted
the
in
influence
that
is just
procedure. Yeah, it's
yeah, the
ridiculous.
influence is such a huge, you know, reasoning for this patient to go through to that
Yeah,
type of
yeah,
treatment, to be honest.
mm, yeah, 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 yeah. So it sounds like the hospital is where your heart is.
Yeah, yeah, definitely.
Yeah,
Yeah, because after Harley Street, I mean, should I
yeah,
continue with
go
the
for it.
story? So
Yeah,
after Harley Street, that's when Royal London came calling. When Royal London came
they
calling, and it
called
was
you.
like, yeah, it was like the oral medicine side this time,
Right.
but I also covered the oral surgery. So I said, okay, it's time.
Yeah,
When I said it's time, I said, okay, it's
yeah,
time to go back. But at the
yeah,
same time, I felt, you know, I obtained a very valuable experience at
yeah,
the
yeah.
practice, and then I met a lot of dental nurses in the practice who really wanted to work in the hospital, but they couldn't
Mhm.
get in because they didn't
Okay.
have experience. But I said to them, you know, just keep trying.
Mhm.
You know, hospitals are they're very open-minded now when it comes to recruiting dental nurses. They won't
Yeah,
look at experience of, you know, you don't have hospital experience anymore, but they look at how you are as a person, how you are as a dental nurse. So I was
yeah,
motivating them because at the back of my head, I was saying, you know, you do more a lot than what I do, and my respect to you is more higher than what
yeah,
respect I gave to myself, because
yeah,
you do a lot of things at the same time. Where in hospital, you just assigned for
yeah,
one role and then you just stick to it, and that's it.
yeah,
Your day is done. So when I left Harley Street, it just, you know, it was a very valuable experience for me. And then as soon as I left Harley Street, moving to Royal London, and I went back to the hospital routine, I felt like, yeah,
gone home.
yeah, this is where I belong.
I'm back.
I'm back. So I'm back on the blue tunic, no more scrubs, and yeah, at the oral medicine side at Royal London, again, it's a different experience for me because this time around I'm more focused on the general medical condition that can affect oral health,
Mm.
like lichen planus, white
Yeah,
patch, or oral cancer. Because while doing oral medicine department at the Royal London, we do like consultation most of the time and less treatment.
yeah,
So during consultation, you get the chance to be more proactive in listening.
yeah,
So you get to hear a lot of, you know, medical background of your patient. And for me, it's very important. When you are part of it, obviously you have to stick to to the number one rule to keep the confidentiality of the patients
Absolutely. Yeah, yeah.
and the dignity that they have of what treatment they are going to be undergoing. And I met a couple of professors that I learned a lot from the Royal London Hospital. And yeah, we still do oral surgery every now and then, like extractions and biopsies. And
Yeah.
again, like Guy's Hospital, when we also get to help other departments. So my skills is still up to date, so I can be rotated to
Yeah.
different departments, which
Put
is
you
really
anywhere.
nice for me. Exactly. So when I was at Royal London, I really enjoyed the moment where, it wasn't just the smile of a patient that brings the joy in you, but
Mm.
the feeling of like getting through a severe oral health experience that
Yeah.
they might be undergoing. It's sometimes you
The whole
just don't
journey,
have,
isn't it? It's the whole
yeah,
journey. Yeah.
exactly. Sometimes you just don't have words to put into it
Mm.
when you see this patient. But again, you just have to be empathizing the journey
Yeah.
of what they're going through.
Mm.
I think being a dental nurse as well is very important that you have to put your position to your patient as well,
Yeah.
not just as a professional health, you know, dental nurse.
As a
You have
human.
to be as a human. Yeah, you have to look at them holistically. To be honest,
Yeah.
because the first thing that they need as soon as they step into the clinic or hospital is reassurance, and
Mm.
you have to give them the confidence and as well as to understand the situation of
Yeah.
what they are in. So besides being knowledgeable, you have to be,
Yeah.
very empathy to them
Trust. There's got to be an
and
element of
trust as well.
trust there
Build a
as well,
trust.
isn't there? Because like
Very
you're
important.
putting a lot in a stranger's hands, essentially, aren't you? And
Yeah,
you've got they've got to trust what you're saying, and
exactly.
is so. There's lots of hats we wear, right?
To be honest, yeah, really. I mean, like I agree with you, and I think having a kind of like a mixed gender in the dental nursing side,
Mm.
it gives a different perspective as well for a patient point of view.
Yeah.
Like when male dental nurse like myself, when I approach patient, it's a different kind of
Right.
like yeah, you can see the difference.
Right.
So it gives them the option of a female approach from a male approach.
Yeah.
I felt like I don't know, being a male dental nurse in the hospital, it gives me the privilege to being able to reassure, especially for like the opposite gender, like female
Yeah.
patient.
Yeah.
And then obviously when it comes to same gender male patient, obviously they can be aggressive when it comes to when they're not happy about things and they like to
Yeah.
complain things. I think it gives us the variety of environment approach when there's a different, you know,
Yeah.
gender
Yeah. How do you find being a male dental nurse, like in a predominantly female in
female.
like what have you come up against, if anything, like
I,
the pros and
I
cons?
I think for me, the pros is that I would say you're uniquely identified easily because obviously I'm the only male or there's only like a couple of
Yeah.
male,
Yeah.
and being surrounded with a lot of female dental nurses, I get a lot of respect
Good.
for this role, and obviously they always seek to my different knowledge as well and
Mm.
skills,
Yeah.
because obviously a male and a female have different type of mentality
Mm.
that they bring in.
Yeah.
They bring a different experience as well. I
Mm.
think the cons would be, I don't know. I wouldn't say there's a cons, but I think maybe because we are less popular, so we
Mm.
don't tend to. We I don't know. We're a bit out of the context as a male
Yeah.
dental nurse,
Yeah.
but at the same time, I think male dental nurses now are growing more.
Good.
From I mean, like right now at present,
Mm.
so there are
Yeah.
more male dental nurses coming in
Yeah.
than previously.
What would you
So
say to any potential male dental nurse
mm,
thinking about it, or what would you say? What
I
advice
would
would you give
s-
them?
I think the best advice I would give to that male person would say, just go for it. If if your heart is in it, just
Yes,
follow
yeah,
it.
yeah,
Yeah, I
yeah,
mean, you can't be just looking at, the ratio of being 1 to 500 female
yeah,
dental nurses up
yeah,
from
yeah,
you. I think
yeah,
you just have to enjoy the side of having a blend of gender in the dental
mm,
nursing career.
yeah, yeah, yeah,
Because for me, it gives me a joy of working with a lot of female dental nurses because
yeah,
we're teaching each other, we're learning
yeah,
from
yeah,
each
yeah,
other, as well as there's always like a sisterhood and a brotherhood within the workplace. So
yeah,
never in doubt, you will build a relationship, and obviously,
yeah,
again, like you mentioned earlier, you'll build trust as well. Because I know
yeah,
it's not
yeah,
easy for a female to trust a male, and at the same time, vice
yeah.
versa.
Sadly, yeah. Yeah.
Yeah,
Yeah, but it's good. It's good to have a good team, isn't it? Like,
yeah,
and then
definitely.
gender aside, you're all there as a team. You're all wanting
Yeah,
the good things for the patients. You're all wanting that satisfaction of your day. So at the end
hmm
of the day, it's irrelevant to what gender we
exactly.
are.
It's really
We all
relevant.
just want the same thing, don't
Yeah,
we?
definitely.
Absolutely. Yeah.
And
So where
then
are you now?
So after Royal London, obviously COVID came along, and
Yes.
then our hospital was shut because of the COVID pandemic. And
Yeah,
then
yeah,
when it
yeah.
was shut, obviously the news that was brought to us was you all of us will be redeployed to the main Royal London Hospital because the
Right.
Royal London Dental Hospital is separated from the general Royal London Hospital.
Yeah.
So when we got the news and I found out about it, I said, obviously I was really scared. That was my
It
first
was a scary
impression.
time.
Yeah, it was a scary time, and there's a lot of news going on in the media, and you're
Yeah.
like, oh, what's happening now? Am I going to, And then I just accepted the fact that it is what it is. I'm here to do my healthcare profession
Yeah.
as a dental nurse. So yeah, I said I again from the beginning of this podcast, I said I always give motivation to myself. Okay, this is it. Let's just do it. You know,
Yeah. Yeah.
time is ticking. We're here to
Yeah.
save lives.
Yeah.
So when I was first redeployed on my first day at the main Royal London Hospital, obviously I was in the COVID ward. It was such a like it feels like I entered a horror scene, to
Yeah.
be honest. Like
It
my
was like that,
mindset,
wasn't it? It was like some
yeah,
weird movie. Yeah.
yeah, my mindset is a bit like a lot of anxiety, a lot of fear. am
The
i going
unknown.
to am I going to catch it? But at the same time, I changed my perspective as soon as I stepped in there, and I said, I'm here to save these patients. Even though I'm in my career, I'm a dental nurse. At the same time, I can do more beyond it. And obviously, I'm also mixing my skills from my dental nursing career with my previous 2 years experience as a general nursing as a student, which was really helpful. It gives me like a refresher when I went back to help out in the COVID ward. So I met
Yeah.
a lot of different professionals, and guess what? When I was doing some um, arterial blood gases, I was processing it, and then I met this person. I was like, "Oh, you redeployed as well?" And he said, "Yeah, yeah, I am." "Oh, you a?" And then I didn't realize that he was a cardiologist. Can you
Oh wow.
believe that? Yeah,
No
it's like
way.
wow. It's just like such a multidisciplinary mix
Yeah.
of professionals inside, and I was
Yeah.
so honored. Like wow, like for someone like a
Yeah.
cardiologist helping out in the COVID
Working alongside you.
pandemic. Yeah, it
Ah.
was amazing. And then obviously, I met a lot of nurses. They were really supportive,
Mm.
and obviously, I have to introduce myself and what I do. We just there helping each other, and it's just that the whole learning curve from donning the PPE,
Mm. Another
infection
level.
control, it's such on another level. And
Yeah.
when you have like a bad day, when someone
Yeah.
didn't make it,
Yeah.
obviously emotionally you have to be composed, and you have to be
Mm.
strong for
How
the
did you deal with that?
relatives.
How did you deal with that?
Um,
Okay, like
Emotionally, I think I I normally held back, like, normally I would be like, I'm a type of guy who, like, I can cry easily. Like, I watch, like, on my during my hobby, I watch like K-dramas.
yeah,
So
yeah,
when I get attached to it, I feel it inside, and
yeah,
I
yeah,
think I,
yeah,
I can be sensitive as well. But
yeah,
during work time, I know how to set aside. So I know how to portray myself in front of,
yeah,
relatives and
yeah,
someone didn't make it. And obviously, you have to be compassionate, and be
hmm,
careful with your words, and just
yeah, yeah,
be sympathizing them. So I have to held back my tears, and then just say, you wish that,
mm,
it could have been worse if, if he or she still stayed, what I
yeah,
mean. So yeah, I think I personally, as I'm a strong person, but at the same time, I always think about my family during that time, because you can't
yeah,
be close to each
yeah,
other.
yeah, yeah,
You have to be away, and you always keep on, checking on them through like video call.
yeah.
So that was the tough times. It lasted like, I think, 2 years, right? Two
I think
years.
it's about that, was it? It felt like forever,
Yeah.
but
Oh, yeah.
yeah,
I
yeah. Was it
was,
all in
yeah,
all
I'm-
about
I
2 years?
was,
Yeah,
I was so glad that it's finally, over.
I
It's
think we
just
all
like
were.
yeah, I was so glad. And then after my Royal London experience, I did apply for a senior dental nurse in our newly opened Tooth Fairy. It's called Tooth Fairy because we opened like a theater inside our dental hospital, which solely focus on pediatrics.
Right.
So like pediatric extractions or
Hmm.
small biopsy procedure. Applied for it, and unfortunately, because it was such a competitive
Mm.
interview, I didn't get it. So I was really disheartened,
Oh,
when I found out. I said to myself, maybe it's not for me. Maybe another door will open,
yeah.
and
Wasn't meant.
then exactly what meant to be will come to you, and if you just be more patient. And then after a few months, then Homerton came. I saw a opening at Homerton, and then it says that like main theaters,
Mm.
general side is not just dental hospital, it's general hospital.
Mm.
And then they're
Ev-
accepting a dental nurse. uh, it doesn't even require experience, as long as I have the knowledge and
Mhm.
the education part of it. So I applied for it. I said maybe this is my calling.
Yeah,
you know
and
I-
it's got
I'm
home in the title, right?
Yes, yes, exactly. You are right. Yes, there was home. So another sense of belonging again.
You
This is
see?
this was my time. So so when I applied for it, I said, okay, I'm gonna apply for it, but I'm not gonna expect that I will get it. But I'll always, I'll just do my best during my interview. During my interview, obviously, you have to learn everything about Homerton, trust values,
Mm.
the job description and everything, my dental nursing side of, max fax and oral surgery. So I came very prepared. I think down the line, I prepared like at least almost a month and a half before the
Wow.
interview date. So I was really going all out. I said,
Yeah.
"This is it. I don't want to miss out on this
No,
again."
I want this one.
Yeah, so I challenged myself. Yeah, I'm gonna, I will aim to grab it, but I'm not gonna expect much.
Yeah.
So when I had my interview, I remember they always ask you, "Do you have any more question?" And so I said, I was just straight to the point. I was like, I'm just gonna be directly honest to this interviewers. I said, when am I going to find out whether I get it or not? And then and they were like, probably this afternoon or tomorrow, they said.
Okay.
So I said, okay, thank you so much. Thanks for your time. Shook their hands and just went away. And then after a few hours, I think it was around almost 6 o'clock, I had a phone call. And then it was like, when it's private, there's no
Yeah.
number. I
Yeah.
already know that it must be them. So
Something's
when
going
I,
down.
yeah, when I hold my phone and I said, "Oh, hello, hi. Yeah, it's Ren speaking, and then like, oh, I'm sorry to say, she started, the person on the phone said, I'm sorry to say, but you got the job. And I was like, oh my
Hey.
god, I was like, oh my god, you made my heart trembles after you said that.
Oh,
But from that moment, I was like, okay, this is it. This
this
is
is
main
it.
theaters. Because I think from the beginning of my nursing career, prior to being a dental nurse, when I was a student nurse, theater was always been my dream environment to work in.
Mm,
I think it's just the whole setting, the whole operating table, the whole
yeah.
surgical gowns, everything is like for me is so intriguing and very interesting.
You've got the
So
best of everything.
yeah. And
Your mum
then
must be so proud.
yeah, she's very collective in terms of emotion, but I'm sure she is. I'm sure she is. She doesn't say much, but I'm sure she is very, very
Oh,
proud.
absolutely.
Yeah.
Yeah.
And plus, guess what? Because
Well,
my mom used to work at Homerton. She used to be,
no.
yeah, she used to be a nurse there before she retired. And so I guess it was meant to
It was
be.
a sign.
It was like
Yeah.
destined, yeah. So when she found out about Homerton, she was really happy. But
Yeah.
she doesn't really, let out her emotion, but I'm sure she's very happy.
Absolutely.
And then, yeah, from there, Homerton came calling, and I obviously my first day at Homerton in main theaters. It's a different environment. It's not like dental chairs
No.
or dental instruments. Only
Yeah.
like a few. So I got used to with the whole trust policy about operating theaters, the infection control. During my first day at Homerton, I think COVID was still lurking, still.
Mm,
So we were like putting a mask on and everything, but it wasn't as bad. And then I got to learn the routine of the maxillofacial side of Homerton. I had to inform Homerton as well of my role and my background as a dental nurse and what are my what do you call it, boundaries.
yeah.
There are things that I can't do and can do because obviously I hold a GDC
Yeah.
governing body. I
Yeah.
have my
Yeah.
own
Yeah.
pin separated from the NMC, so I made them aware of it. And obviously, I wouldn't even dare to step out of it and then
No.
just do it. Yeah, I wouldn't risk my pin, to be honest. And so, yeah, we had an agreement where if there is no maxillofacial list or dental list, I will be helping other specialties, which is
Right.
for me, it's a privilege. So I can
Mm,
see other stuff. I can
yeah.
see the bigger picture of theaters, and I was more than happy to be part of it. But the one thing I disagree is like I don't want to be put in the role as a healthcare assistant because
Mm,
I'm a nurse. So that's the
yeah.
one thing I agreed with
First
them.
and foremost. Yeah.
So we agreed to the fact that I'll be a circulating nurse, because
Yeah.
and yeah, so that's the joy being at the Homerton in theaters when there's no max fac side or dental side. I get to see obstetrics, babies being born. I get to
Wow.
see like hernia operation. It's crazy. There's a lot more to see than from being where
Just
where
in
where
a
where, I,
mouth.
where I'm at now. Yeah, yeah, in the mount. So it was really really. I mean, the joy that I had on my first few weeks at
Yeah.
Homerton. It was a challenge
Right.
because I have to find my feet,
Yeah.
um, and I have to always promote infection control at the same time.
Mhm.
Um, at that time, obviously, I wasn't the lead dental nurse yet, so I was learning from the dental nurse who are already there, and I have to pick up things according to my pace. Obviously, I'm not gonna rush myself in learning new things. So
Mm,
I always give myself time because if you rush things, it just messes things up,
yeah. Absolutely.
and it's not an effective learning way if you rush things as well, and if you put yourself pressure.
Mm,
And that's it. I remember on my first day scrubbing at Homerton, there was like obviously there was like this one nurse trying to teach me how the way she lays up her instruments. And obviously, I don't mind, but I think I disagreed to the point where I said
No,
I
thank
would
you.
like to be me controlling it rather than being told
Told.
every single minute. So yeah, and then she stopped bugging me, and I was like, oh, thank God, finally. I want it my way, but
Yeah, yeah, yeah,
I will learn I will learn the correct way, but I will want my layup my way.
yeah,
So
yeah. High
that's what I
five.
said
Yeah,
back of my head. Yeah. So yeah, at the same after that, that's it. Like I was on my own, and
yeah.
obviously I get to know the surgeons, who are they, and obviously when they ask me like, oh, where did you come? Why did you move to Homerton? I said, oh,
Mm.
because I wanted to be in theaters, and I remember during my interview, my main aim joining Homerton was to be an ODP, an operating department practitioner. Obviously, it's not easy to just go in straight away. You have to make a path and take it one step at a time.
Yeah.
So, so I said, yeah, having an experience right now in main theaters will build up my confidence and
Mm.
my skills and knowledge about
Yeah,
the environmental setting. So right now I'm still on the like the waiting list for the ODP course, because
yeah.
it doesn't mean that if I go for ODP, you will leave dental nursing. I don't
No.
mind having multiple qualification or
Yeah, yeah,
like
yeah. Don't
two
leave us
different
behind.
side. Yeah, exactly. Just in case. You never
Mm.
know. I mean, like I said from my bio, you never
Mm.
stop learning. You never
Love
stop
it.
learning. It's just the way how life is.
Yeah.
Life goes.
Such a journey. Like you've got
Yeah.
so much knowledge and experience to share. It's
Mm.
amazing, and we're so
Yeah.
glad that you've joined the team. So, what are you going to bring to the
Mm.
table for us? What are you hoping to spread the
Well,
joy?
I think I would obviously my main aim joining SBDN is to share my knowledge
Mm.
and my experience being in the hospital throughout my dental nursing
Yeah.
career. And obviously, my path has been like a well, not even a roller coaster, but more like a different route, like
Yeah.
from
Yeah.
M11 to M25.
Yeah.
Like you're driving in a motorway.
Yeah. 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 Yeah.
So yeah, I think my experience, to be honest, and showed that a dental nurse can be more of what where they are now.
Yeah.
We can expand more to our roles if we allowed ourselves to.
Yeah.
You
I mean, to
know.
go from where you did right back in the beginning, like all
Yeah.
those different types of nursing that you went through
Exactly.
to where you are now. A lot of nurses wouldn't know
Yeah.
that was a path at all.
I mean, like if I can brainstorm my dental nursing career, there'd be a lot of like lines all over, and
Yeah, yeah,
it's just connected in one place. And
yeah.
yeah, I think I'm very blessed to be part of SBDN, and obviously as a male dental nurse,
Absolutely.
it
Yeah,
also shows that a male dental nurse like myself can go as far.
yeah. It's brilliant.
That
Honestly,
yeah.
I'd want to sit here all day and listen to you, Renz.
Thank you.
No. So, if we wanted to find out more about you or catch you, where are you on the socials? Where can we find you?
Um, in socials, on Instagram.
Okay.
So I'm on the RPBS 0488. It's a bit of a mix up of. I don't solely focus on my dental nursing, but I always share.
I've stalked
Yeah,
you.
yeah. And I also like I do like a hobby as a YouTube vlogger. So that's my
Yeah.
another passionate hobby that I do every now and then.
Is that like
Um,
your like I do a lot of running. So when I'm not dental nursing, my breathing space, my
yeah,
time is running. So is that the same for
exactly.
you? Yeah.
Yeah. And
Yeah.
obviously the reason why I don't do much dental content is obviously, we know the policy about, doing vlogging
Yeah,
in the
yeah, yeah, yeah,
hospital.
yeah, yeah.
So I'm very much aware
Keep
of
it
it.
separate. Yeah.
And then I remember when I had my first SBDN meeting and I met Fiona for the first time, and she was talking about social media. I think I had a conversation with her saying, I'm fully aware the do's and don'ts
Yeah. Yeah.
during
Yeah.
on the social media platform, but at the same time, if we can make a platform where it could be like an educational platform
Hmm.
for the dental nurses and oral
Yeah.
health.
Mm.
That's my another goal, to being the new ambassador in
Yeah.
SBDN. I would like to spread awareness of oral health in YouTube,
Yes.
um,
Mm.
and meeting other professionals, and get to know them and learning what they do. I think that's
Really.
why I shared with Fiona, to be honest.
Yeah. Well, we've just started up our YouTube channel again
Yes.
now with the pod, so I'm slowly dropping bits in there, and we've also recently started the TikTok, so we need to bounce here. We
Yeah. We need to create more
yeah, send them over
ideas.
to me, and yeah, we'll get them on. We'll bounce
And
some ideas.
I would love to, meeting you in person, or
Yeah.
anyone that we can do something creative
Yeah. Yeah.
for fun, just to enjoy. And
Absolutely. Yeah. Yeah. No, it sounds great. Great.
yeah.
Oh, thank you so much for
You're
today,
very
Renz.
welcome,
I'm
Cheryl.
looking forward to everyone hearing about your
Thank you,
story,
thank
and
you.
obviously we're going to hopefully be seeing more of you through the SBDN, and sharing your
Definitely.
knowledge, and getting all that
Yeah.
out there. So thank you
You're
everybody
welcome.
that's listened today. You can catch this pod on Apple Podcasts, you can catch us on Spotify, we will be on YouTube, and you'll also catch little snippets of today on TikTok as well. So for now, it's a goodbye from myself and goodbye from Renz, and we'll see you all
Bye.
soon. Bye.
Bye.